Medicare can be confusing. It's a complex system with many moving parts, and for many seniors it feels like navigating a labyrinth. It's a maze of options and paperwork. The sheer volume of information can be overwhelming, making it hard to know which path to take. So when someone offers you a simpler, cheaper alternative, it's tempting. A friendly face explaining an easier way can feel like a lifeline. That's what Medicare Advantage plans promise. They market themselves as the all-in-one solution to your healthcare needs. They offer everything under one roof: hospital visits, doctor's appointments, sometimes even vision and dental. It's like a one-stop shop for your health. Plus, the premiums can be lower than traditional Medicare. Saving money while getting comprehensive care sounds like a win-win. Sounds like a dream, right? The idea of simplified, affordable healthcare is incredibly appealing. Well, hold on to your wallets, folks, because things aren't always what they seem. These plans are everywhere, and the reality can be quite different. You see them on TV, hear them on the radio, even get glossy brochures in the mail. The marketing is relentless. Even AARP recommends them, but keep in mind, AARP receives over $1 billion in royalties every year to promote Medicare Advantage. It's a full-blown marketing blitz, and those smiling faces are very persuasive. They paint a picture of ease and savings, but there's a reason these companies are spending so much money to get your attention. It's not just about helping you. And that reason, my friends, is profit. The bottom line is that these companies are in it to make money, and sometimes that can come at your expense. Medicare Advantage plans are run by private insurance companies. These companies are responsible for managing the healthcare of millions of Americans, especially the elderly. And just like any other business, their goal is to make money. They focus on maximizing their profits while providing healthcare services. The government gives these companies a fixed amount of money per person they enroll, which happens to be about $1,000 a month or $12,000 a year. This is known as a capitation payment. Now, if they can provide your healthcare for less than that amount, they get to pocket the difference. That's their profit. This creates an incentive to cut costs. This is where things get a bit icky. Sometimes cutting costs can mean cutting corners on patient care. Remember those sicker patients we talked about? They often require more intensive and expensive care. Well, the government gives insurance companies more money for people with more health problems, which can amount to over $1,500 a month instead of the $1,000 I just mentioned. This is supposed to ensure that sicker patients get the care they need. It makes sense in theory, right? The idea is to balance the financial risk and ensure adequate care. Healthy people only qualify for about $600 a month premium paid from the federal government. So would the private insurers rather get $4,800 a year for a healthy person or $18,000 a year for a sick person? Sicker people need more care, so the insurance company needs more money to cover those costs. However, the system can be manipulated, leading to potential issues in patient care. Here's where the illusion of savings starts to crumble. Because the insurance companies are incentivized to make their customers appear as sick as possible, they sometimes resort to some shady tactics. I mean, with over 32 million people on Medicare Advantage and gross margins of $1,600 per person per year, according to Kaiser Family Foundation, insurance companies stand to make over $50 billion in gross profit per year. They might overdiagnose conditions, making you seem sicker than you actually are. The sicker you are, the higher your premium. So the sickness scores will surely go up. According to the Wall Street Journal, sickness scores went up 55% in 1 year when United Healthcare took over the doctors. This means the insurance companies get more money from the government, but it also means you might end up on medications or treatments you don't really need. And those lower premiums we talked about, well, they often come with a catch. Medicare Advantage plans usually have limited networks of doctors and hospitals. Step outside that network and you could be hit with hefty, out-of-pocket costs. So, what's a savvy senior citizen to do when faced with the complex world of Medicare options? It can be overwhelming, but don't worry, we're here to help you navigate through it. First, don't be swayed by slick advertising. Do your research, compare plans carefully, look beyond the surface and dig into the details. Pay close attention to the provider network. Make sure the plan includes a wide range of healthcare providers. Is your trusted doctor included? This is crucial for continuity of care. What about that specialist you see regularly? Ensure they are part of the network too, and don't just focus on the monthly premiums. While they are important, they are not the whole picture. Look at the co-pays and deductibles. These out-of-pocket costs can significantly impact your budget. Those can really add up, especially if you need a lot of medical care. It's essential to consider your overall healthcare needs. Choosing a healthcare plan is a big decision. Take your time and weigh all your options. Don't be afraid to ask questions. The more information you have, the better. Talk to your doctor, your family, and maybe even a financial advisor. They can provide valuable insights and help you make an informed decision. And remember, when something seems too good to be true, it probably is. Be cautious and thorough in your evaluation of Medicare Advantage, and especially when it comes to your healthcare. Your well-being is worth the effort to find the best plan for you. Make sure your insurance company is not over-testing you and over-diagnosing you through your healthcare professional. It happens more often than we would like to think it does. And if you are a decision maker at a company or public entity that has a privately funded health plan, our company FinHealth can help analyze your company's healthcare spending to find overpayments and other missed discounts, hospital overbilling, even out-of-compliance contracts or out-of-control prescription drug costs. Contact us at finhealth.com. That email is sales@finhealth.com.